Did you know that May is Hypertension Awareness Month? I'm here with Dr. Kambelos, Medical Director for Buckeye Health Plan, to explain why Ohioans should know what hypertension is and how they can manage it to improve their health. Dr. Kambelos, thanks so much for joining me today.
Pleasure to be here as always.
Such an important topic.
Yes.
So, Dr. Kambelos, what is hypertension and why is it a big deal for people here in Ohio?
Well, let me explain what high blood pressure hypertension means. First of all, that basically means a higher pressure inside our arterial tree, or the pipes inside our bodies that supply our vital organs. Why it's important is because 1 out of 3 Ohioans have high blood pressure, and uncontrolled, unchecked, poorly controlled can lead to some very serious health consequences, including strokes, including kidney failure, and including the #1 killer of Ohioans, and that's heart disease.
Wow, let's back up and look at what causes hypertension.
Okay, so hypertension, there are many things that can lead to or contribute to high blood pressure or hypertension. Many of those things are lifestyle related, some are not, but let's touch on some of the lifestyle issues. For instance, one would be excessive salt intake. Another would be excessive caffeine intake, excessive alcohol intake. Smoking cigarettes, big one. Additionally, sedentary lifestyles, being overweight contributes to hypertension. And in addition, there are family history items perhaps that could relate if these things sometimes do tend to run in families. In addition, we're always thinking about the aging process because that stiffens our blood vessels and contributes to hypertension. And then, of course, there are outside medical issues like sleep apnea, for instance, which can raise blood pressure and contribute to a problem.
Wow, I didn't know that. So are there some people more likely to develop hypertension than others?
African Americans are clearly at higher risk, so that's a population that requires special focus.
Okay, how can you tell if someone has hypertension?
In many cases, the symptoms are fairly common and do also overlap with other problems, but some of the more common symptoms and signs could be headaches, nosebleeds, problems with vision, dizziness, chest pain, trouble breathing, shortness of breath, swelling of the feet or ankles. However, 1 out of 5 individuals will have no signs or symptoms whatsoever until there's a sentinel event.
Right.
And that could very well be a stroke or a heart attack, and by then in many cases the problem is fairly advanced. So that's why it's so important for people to know their numbers, to get their blood pressure checked, and to see their medical doctors on a regular basis.
Because it sounds like it is something that could sneak up on you if you're not careful. What numbers should Ohioans be aware of when it comes to high blood pressure?
Let me explain how blood pressure is measured and reported, first of all. So there's usually there are 2 numbers reported, the top number and the bottom number, so the systolic and the diastolic. The top number, and they're both important, by the way,
right.
The systolic is representative of the pressure in the arterial tree when the heart squeezes out that blood into our bodies. And the diastolic, or that bottom number, represents cardiac relaxation when the heart fills with blood. Now, anything over 130/80 is considered high, but there are several stages of high blood pressure beyond that.
Okay, good to know what is about normal, would you say? So how do you manage and treat high blood pressure?
Well, for those who consume excess salt, would be to recommend that they cut back on their salt intake, caffeine, alcohol, more exercise, get more sleep, reduce stress. If there's another medical issue like sleep apnea, to address that. We obviously can't change our family histories or the aging process, but then again, in many cases, medication is required in combination with those lifestyle changes that we just talked about. And it's important that people are consistent when they take their blood pressure medications. There are some very serious consequences to stopping blood pressure medication abruptly, including rebound hypertension, which certainly could lead to a stroke. And again, it's very important that people maintain follow-up with their primary care physicians.
Yeah, a lot of people think they can, I don't need to take it today, I can take it tomorrow, but they need to be consistent.
Consistent.
Yeah. So how does Buckeye help people with hypertension?
Buckeye Health Plan is transforming the health of the community one person at a time. We sincerely care about our members, and it shows. We surround them with resources and information that can help them along their health journey. That includes care managers and case managers to whom our members can reach out for additional information. Let me also say that we can also help our members by making a primary care physician's appointment for them, getting them to that visit and paying for that transportation. In addition, we do have financial rewards for our members when they complete certain health milestones, such as getting their regular health checkups and getting certain vaccines.
Well, it sounds like Buckeye provides a bunch of support for people out there who might need it.
We do.
We appreciate it.
I'm proud of it.
Yes, Dr. Kambelos, thank you so much. For more information about high blood pressure, all you have to do is go to BuckeyeHealthPlan.com/heart.